All right, good morning, everyone, and welcome to the third installment of our Acadiana Business Resource Webinar Series. These webinars are brought to you by business resource partners from across the Acadiana region, including One Acadiana, LEDA, Opportunity Machine, the Downtown Development Authority, the Louisiana Small Business Development Center at UL Lafayette, Acadiana Workforce Solutions, the United Way of Acadiana, and other local chambers and economic development offices from around the Acadiana region. We have come together to support Acadiana's business community, particularly our small businesses, in response to COVID-19 by hosting a series of webinars on timely and relevant topics. Today's third installment of our Acadiana Business Resource Webinar Series is presented by Nooner Pate on managing your workforce in response to COVID-19. The employment law implications. After the presentation, we will use the remaining time for Q&A. As you have questions, please enter them into the chat bot, which can be accessed using the chat bubble icon. We will be recording the questions as we go. If we do not have time to get to your question during today's webinar, we will follow up with you as soon as possible afterwards, and we will try to compile a list of questions and answers to share with everyone. Without further ado, I will now turn it over to Cliff LaCour, attorney at Nooner Pate, to kick off today's presentation. Cliff.
Thank you, Andre. Good morning, everybody. As you might imagine, this has been a very interesting time for attorneys because we're getting lots of new acts very quickly done. Today, we're going to talk a lot about the Families First Coronavirus Relief Act, which is the phase 2 of the various different things that we're seeing coming out of the administration and Congress, with phase 3 just coming out on Friday, the CARES Act, which is a lot more stimulus-based, I guess, than actual employment law-based. So there's some things in there to encourage employment as well. I'll be focusing on this act, but I mean, if you have any questions about employment law in general in responding to this, I'm happy to answer those as well. And I have a partner with me, Lance Pearson, who is going to be helping me with the chatbot and kind of fielding a lot of the questions and chiming in from time to time, make sure that I stay on task and correct in what I'm telling you guys. One of the many things that are interesting about this act is that from the time of drafting to the passage was only a week. As a result, there's a lot of unknowns within it. We've been getting guidance from the Department of Labor slowly but surely, but none of it is really binding or definitive yet. And until we get regulations from the Department of Labor on a lot of this stuff, we can tell you what the guidance says and we can tell you what we think is going to happen, but a lot of that information is very preliminary until we get those regulations. Now, despite what everybody thought that this would go into effect on April 2nd, because the act says that it shall go into effect no later than 15 days after the passage of the act, which would be April 2nd, the Department of Labor actually did decide to make it effective tomorrow on April 1st. We learned this by and large through the posters that were put out just last week that everybody has to post, that they decided to make it effective as of April 1st. In some good news, the Department of Labor has said, hey, we're gonna not file any enforcement orders for 30 days, but that 30 days is from March 18th to April 17th as a result of this act, as long as you act reasonably in good faith. So this doesn't mean that you don't have to comply with this act during that time. You absolutely have to basically attempt in good faith to comply with these orders, with the statute and how it's going to be interpreted. But if you mess up, they're gonna come and they're gonna tell you, hey, this is you messed up here. You really have to fix this, and you have to promise to fix it. Basically, what they're going to look at, and they put this in some guidance as to what reasonably in good faith attempt to comply is, that you remedy any violations as soon as practical. The violations were not willful, meaning that you didn't know or should have known that these violations were actually violations. I mean, for example, if you just don't give somebody the leave that we're going to talk about completely, even though you're a covered employer, that would be a willful violation because you know about it. And then finally, if the department receives written commitment from the employer to comply with the act in the future, then you're not going to have any penalties for that kind of a failure during that period. And that's solely at the discretion of the Department of Labor. They've put that out and they've decided to do that. but you still at least have to comply with the act, or at least try to comply with the act. We can go to the next slide, please. So there are a couple things under this act that are important for employers to know. First of all, this does not affect your ability to, if you have a business need or generally you just need to, if you need to lay off employees, if you need to let them go because you're not able to do your business, this doesn't affect that. The CARES Act, which came out on Friday, does provide incentives for keeping people on as long as you can. And there's certainly incentives in there that potentially up to 8 weeks of payroll will be loaned to you via the SBA, and later potentially or probably forgiven under the Paycheck Protection Act. There's a bunch of other provisions in there as well that we're not going to dive too deeply in because we're still waiting on a lot of information on that as well. But we're going to kind of focus today on what the Families First Act sort of did, or actually did. The first thing is, for the first time in history of America that I'm aware of, there is a now federally mandated paid sick leave. This has been something that people have talked about for a long time as being something that would come out. This is a temporary measure. Both the leave acts that the provisions of leave that we're going to talk about today expire on December 31st of this year. So they're not permanent, and they are very COVID-19 coronavirus specific. However, I suspect, depending on how administrations follow, that since this has been something that's been in the works for a long time and actually has some bipartisan support, it may lead to some sort of a sick leave requirement going forward. And what that will look like, we don't know yet. But at least for this paid sick leave, this requires employers with less than 500 employees to give 2 weeks of paid sick leave if an employee is unable to work or telework because of 6 very specific reasons. This is odd for an employment statute because normally employment statutes, at least at the federal level, talk about so many employees or more, for example, 50 or more employees or 25 more employees. But this is actually targeted at smaller businesses. And that's a big deviation from what we typically see. The stated reason was that the Congress believed that employers who had more than 500 employees typically already gave sick leave. Now that's not entirely true because you have lots of corporations who have lots of low-level employees who don't get that sick leave, but it's very targeted toward small, medium-sized business with only less than 500 employees. So what are the 6 reasons that you could qualify for this emergency paid sick leave? The first is that you're subject to a federal, state, or local quarantine or isolation order. There are a lot of questions out there on this one due to all the stay-at-home orders that have been placed all over the country. And the big question that we're seeing that we don't have a good answer to yet, but I'm going to give you an educated guess on, is that stay-at-home order a quarantine or isolation order? We don't know yet, but we suspect, based on how those words have been used in the past, how quarantine or isolation has been used in the past, we suspect that the stay-at-home orders will not qualify for this. Typically, quarantine or isolation order deals specifically with an individual. So if somebody has been exposed or actually has the disease, and that's how it's been kind of used in the public health realm in the past, they would be subject to quarantine or isolation. Just because you have to stay home does not qualify as quarantine or isolation. This is where it's important, however, for the regulations to be taken into account, because we need to know how the department's going to enforce it this time. Again, every reason to suspect that they will enforce it or interpret it the same way that they always have, in part because otherwise everybody's going to exhaust this leave very quickly, and there won't be any in the back part of the year when the curve is hopefully flattening and we still have a few people getting it, but it's getting better. So that's the first reason. Second reason is that they have been advised by a healthcare provider to self-quarantine. Again, it could be because they have an underlying issue. They may not have been exposed. It could be for any reason related to self-quarantine related to COVID-19. The third is that they're experiencing symptoms of COVID-19 and are seeking a medical diagnosis. You can't just have a fever and say, I'm staying home, giving my leave. You have to also be seeking a medical diagnosis at that point. The fourth reason is they are caring for an individual subject to a quarantine or isolation order or has been advised to self-quarantine. The fifth reason is caring for a child, or actually a son or daughter, whose school or care provider is closed or unavailable due to COVID-19. We're going to see a little bit of a difference between this language here and a little bit later when we talk about the emergency FMLA leave, because here the statute talks about a son or daughter with no age limitation. We've seen some guidance from the Department of Labor that suggests that son or daughter in this context could also include a son or daughter who's over the age of 18 but has a physical or mental handicap and is unable to provide for themselves. That's only as to this 2 weeks. Later, we'll see there's a specific limitation on the Emergency Family Medical Leave Act, where it's a son or daughter under the age of 18 specifically. So there's a difference there in the qualifications, even though this is where the overlap is. And then finally, as a catch-all, if the employee is experiencing any other substantially similar condition specified by the Secretary of Health and Human Services in consultation with the Secretaries of Labor and Treasury. What they're trying to do here is just in case the coronavirus morphs in some way and we have some sort of mutation, that it's not COVID-19, it becomes COVID-20. They don't have to react to all this kind of stuff. The secretaries can get together and say, yes, this is going to apply to that too. We're really hopeful that that doesn't come up anytime soon. That we're only dealing with one type of disease, but they did include this catch-all. Again, what's interesting. Sure.
I have a quick question about when I've been reading the statute, I've been seeing caring for a child. Just now you mentioned son or daughter. By that language, are they excluding other guardians who may have to stay home to take care of children?
So again, you go back to number 4 and you look at it, and it says is caring for an individual subject to a quarantine or isolation order. I think they're excluding other people from the school or care provider. So you can't ask grandma to come in and take the 2 weeks leave. This is my interpretation. Again, wait for the regulations, but it's only as to if your school is closed or your care provider is unavailable that you can take that leave. If you're caring for, if grandma is caring for the grandchild who's subject to a quarantine or isolation order or advised to self-quarantine or what have you, then that leave may well be triggered. But just because school's out, grandma can't take the 2 weeks off. Does that make sense?
Absolutely.
So again, what's important is just because you're at home taking care of your kid because their school's out, that alone isn't enough to trigger it either. You also have to be unable to work or telework. So there's several checkboxes that have to be checked. Some people just can't telework from where they are because of the nature of their job, or it may be because they're sick with actually COVID-19 and such that it's just impossible, or that the kid just requires too much attention to go through the lessons to get it done. It doesn't give real reasons for what qualifies as not being able to telework yet, but that's an important distinction, because just because you're home doesn't mean you automatically get it as well. Somebody I think asked, how do you define an employer? An employer at this point is anybody who employs an employee. That is the Fair Labor Standards Act definition. In this case, it's any employer that employs less than 500 employees. In terms of affiliated groups, again, we use the Fair Labor Standards Act definition. And in general, unless they're considered a joint employer under the Fair Labor Standards Act, every company will be considered a separate employer. Now, if you're a joint employer where you kind of share employees and that's special rules, we'd have to look at that on an individual basis. And if you're considered a joint employer, then you count everybody together. But typically, in a normal situation, the Department of Labor will consider each individual company to be an employer. I hope that answers the question. So how much leave do you have to give under this emergency paid sick leave? Leave is up to 80 hours for full-time employees. The guidance that we've seen is that full-time employee means an employee who typically works 40 hours or more a week. So that's how much. And then in addition, part-time employees are also qualified for this. They'd be entitled to the number of hours they would typically get in a 2-week period. You usually look at what they would be scheduled for. If they have an uneven schedule, you take the average of the number of hours that they would normally work, going back 2 weeks if it's a set schedule, and if it's not a set schedule, then over the past 6 months. Interestingly, if a full-time employee normally works more than 40 hours, if they work normally 50 hours a week or more, or whatever it may be, in week 1, they can take all 50 hours, let's say. They don't get an overtime premium for those other 10 hours based on leave, but they can take 50 hours in that week 1. They still only have 30 hours left for week 2, however. It's capped at 80 hours no matter how you divide it up, but it could be a little bit more in week 1 if they would normally have more than that. Further caps are that for self-care, quarantine, or isolation, those first 3 examples that we talked about, and Andre, you can flip the slide as well. I'm sorry. Those first 3. Actually, that's fine. Those first 3 that we talked about, you're entitled to 100% of your pay, up to $511 a day, and $5,110 total. And for the care of others and similar situations, the 4, 5, and 6, entitled to 2/3 of your pay, up to $200 a day, and $2,000 total for the emergency sick leave provisions. This is in addition to anything else that you give your employees. In true no good deed goes unpunished way to do things, if you're generous with your sick leave, you have to give them this leave before you let them use any other leave that you may have. Now, there's nothing to say that you can't amend your leave policies today. If they've already earned it, you got to give them what they've already earned. But if it's a mere gratuity, you want to update your leave policies to reflect the new reality, you can do that. But you have to give them this leave before any other type of leave that they have. Any leave granted prior to the April 1st effective date does not count. So this is not retroactive in any way. If one of your employees has already had some sick leave as a result of COVID-19, and they're still an employee come 4/1, they qualify for this leave all over again. Employers with 500 less employees, or 500 or more employees are simply not covered. There is a potential limited exception for small businesses under 50 employees, where granting the leave would jeopardize the viability of the business as a going concern. And just recently, they have given us a little bit of guidance on this. The latest that I have seen is that we were unsure for a long time of whether the department would have to certify or you'd have to apply for this exception. The latest guidance that we've seen, and again, this is not necessarily legally binding, but it is that in order to qualify for the 50 or fewer, you have to have a 50 or fewer employees, and an authorized officer of the company has to certify that the provision of the Sick Leave or Expanded Family Medical Leave Act, it's going to be the same test, would result in the small business expenses and financial obligations exceeding available business revenues and cause the small business to cease operating at a minimal capacity, or the absence of the employee or employees requesting sick leave or expanded family medical leave would entail a substantial risk to the financial health or operational capabilities of the small business because of their specialized skill, knowledge of the business, or responsibilities, or there are not sufficient workers who are able, willing, or qualified and who would be available at the time and place of need to perform the labor or services provided by the employee or employees requesting paid sick leave, Expanded Family Medical Leave Act leave, and these labor or services are needed for the small business to operate at a minimal capacity. This is good news if this holds, is that you can certify this as an officer of the company. You don't have the Department of Labor have to wait for them to sign off on it. I have a feeling this is where there's going to be a lot of litigation for small businesses, though, because okay, the officer certifies it, and employee A doesn't get their leave. There's going to be litigation over whether that certification was true and correct, and that's going to spin up a lot of litigation, in my opinion, down the way, because there's no blessing by the Department of Labor saying yes, we agree with this. So that's going to be another interesting a bit of litigation that we're going to see. So on how do you determine if you have 500, or when do you determine when you have 500 or fewer employees? Actually, it's less than 500 employees. If you have 500 employees, you're actually excluded. It's 499 and below. That count, you can move in and out of coverage. The count of employees is at the time the leave begins. So if on day one, on April 1, you have 501 employees and somebody comes and says, I want to take the leave, well, you don't have to, and I want it to start today, you don't have to give it to them. If 3 days later, 3 people quit and they're no longer in your payroll, you're now in the covered employee, and if somebody comes and says, take the leave, I want to take the leave, you got to give them the leave. And which employees count? Pretty much every employee counts, whether temporary, part-time, full-time. If they're on your payroll, they're pretty much gonna count toward that 500 threshold.
And Cliff, Mr. Bush asked whether independent contractors were counted, or whether they have protections, they need to seek their own protections. And I believe independent contractors are not counted in the 500 employees. And actually the CARES Act, which, isn't a topic of this webinar, but they have their own protections therein to kind of recoup their losses or have paid leave, right?
That's correct. True independent contractors. And this is something I don't want to say I fight with my clients a lot about, but it's something that I discuss with my clients a lot about. If they are true independent contractors, they do not count. If they're an employee being treated as an independent contractor, which is always an issue, then they may end up in the count. But absolutely, independent contractors don't count, and they're not entitled to these leaves because they're independent. That's absolutely right. Actual employees are covered from day one of employment. There's no minimum hours threshold, if you hired somebody today and tomorrow when this goes into effect, they ask for leave, you got to give them the leave. It doesn't matter how long they've been with them. The Secretary of Labor will probably and may exclude certain healthcare providers and emergency responders. Please note that if you have emergency responders or healthcare professionals on your payroll, that doesn't mean you're an exempt employer. It just may mean that those employees are exempt. So if you run a clinic and you have a secretary there, she's probably not going to be an excluded healthcare provider or emergency responder. She may still qualify for the leave, even if your doctors and nurses may not. How can this leave be taken? So it can kind of be taken intermittently if the employer agrees. So if they're out if they're teleworking, the employer and employee may agree to pretty much any interval that this can be taken intermittently. If they're teleworking and you say, hey, I know you can only work in the afternoon because you're taking care of your son, that's okay as long as everybody agrees. However, if they are on site, if they are coming into the office, then it can only be taken, doesn't matter for agreement purposes, it can only be taken for a qualified reason in full day increments, and cannot be taken intermittently if the leave is because they're subject to an isolation order, or they're advised to self-quarantine, if they're experiencing symptoms, basically for any reason other than taking care of a son or daughter. The reason behind that is because if you're subject to an isolation order or any of those other things, we don't want you coming into work intermittently because you may have been exposed. So it's only, so if you're continuing to come in on site, then you can only take it in 1 day increments, and it's only for if you're caring for that son or daughter as well. Let me just check my notes, see if I hit everything that I was supposed to on this.
And Ms. Colette has asked whether this statute applies retroactively, and it does not. So it's only going to be from April 1st going forward.
That's absolutely right. So all this stuff does not apply retroactively. It's tomorrow we start dealing with this, and that's both positive and negative again, because it also means that any leave that you've already granted does not count towards this 2 weeks, or as we're going to talk about in a minute, the 12 weeks that we're going to have. Are there any other questions? I guess let's talk about that. Oh, this is all job protected leave. Of course, you can't fire somebody for using it, the penalties and whatnot. Of course, you can't say, if you use this, I'm going to fire you. Under this provision, The penalties will be under the Fair Labor Standards Act. So that means that you could be potentially liable for not only the back pay, but also damages and liquidated damages and attorney's fees as well. So it could be actually an enforcement action as well on there from the Department of Labor. Full-time equivalent, again, is 40 hours or more. Any other questions about this before I move on to the emergent? I'm trying to leave as much time for questions at the end as well. That's why I'm kind of moving a little fast, probably.
Let me see. No, I think you're good. There's a question about tax credits if leave was granted prior to April 1st. You may get to that later. I know it's kind of at the end of your presentation.
Right, and I will talk about tax credits a little bit, but briefly, no. If you gave leave before April 1st, you don't get a tax credit for that because it was not this covered leave. You only get tax credits for, at least under the current bills, you only get tax credits for leave provided pursuant to this particular act, which goes into effect tomorrow. Okay, so let's go ahead and move on to the Emergency Paid Family Medical Leave Expansion Act. This amends the general FMLA, and so any enforcement provisions or acts or what have you would be under the FMLA. However, it's a little different. Again, it's very specific in that it provides 12 weeks of leave if an employee is unable to work or telework, and the employee needs to care for a son or daughter under the age of 18, and the child's school or care provider is closed or unavailable because of COVID-19. Again, that's a little bit different there in that it only talks about leave related to son or daughter, caring for a son or daughter under the age of 18. Now, these two acts go hand in hand in that the first 2 weeks of this family medical leave is unpaid. However, you can use your emergency sick leave to cover that. One thing about the emergency sick leave is that you don't get 2 weeks for every qualifying event, and that's an important thing to know. So if somebody uses their 2 weeks because they were subject to an isolation order or they were exposed in some way, and then later has to care for their son or daughter, they don't get another 2 weeks because they had another triggering event. It is 2 weeks from now until the end of the year under emergency, and same for Family Medical Leave Act, but it's 2 weeks from now to the end of the year that you get those 2 weeks. And then in the first 2 weeks of the are unpaid, the employer cannot require the employee to use the emergency paid sick leave for 2 weeks. That's the employee's choice. The employee can say, no, I want to save those for later, but then go unpaid. The remaining 10 weeks of that 12 weeks is paid at 2/3 of the regular rate. And regular rate is defined just like it is under the Fair Labor Standards Act. It includes all the compensation. And it's capped at $200 a day or $10,000 total. Again, covered employers here are employers with fewer than 500 employees. That means that you can be covered for this FMLA, but not for the traditional FMLA, which requires 50 or more people. You're only going to be covered for this one if you have 25 employees, for example. They do have that same potential limited exception for the small businesses that we've already talked about. Unlike traditional FMLA as well, an eligible employee need only have been on the payroll of the company for 30 days prior to taking the leave. Again, in traditional FMLA, you have 1 year service and 1,250 hour requirement. There is no hour requirement. It's only that they've been on the payroll of the company for 30 days. And again, that's pretty much, it doesn't mean they worked for you for 30 days. That means if they worked for you on March the 2nd and then on March the 18th, and then they've been consistently on the payroll, even if they're not working for you a lot, they still would be potentially a qualified employee to take this leave. It is a job protected leave. There is an exception to this. It's job protection such that you have to give them the same or similar job when they come back, unless you have 25 or fewer employees. The leave was to care for son and daughter. The position no longer exists. You make a reasonable effort to restore the employee to an equivalent position. If there's no equivalent position, you make reasonable efforts to contact that employee if an equivalent position becomes available. And if you're still not there, the employer continues to make reasonable efforts to contact the employee for 1 year, beginning on the date of leave, or and ending on either the 12 weeks after the leave began or 1 year after the date of leave ending, whichever comes first. So there is that protection for really small businesses of less than 25, that we understand that if that position just no longer exists, you can't restore them to it. The EFMLA leave can be taken intermittently as long as the employer and employee agree, and that can be done in any increment. If you know the employer and employee want to agree that it'll be Monday, Wednesday, and Friday, my babysitter can come, but not Tuesday, Thursday, that's okay. Or my babysitter's only available in the mornings, but not in the afternoons. As long as the employer and employee agree, that's fine. If the employer just can't work that out, then they may just have to take their leave all at once. You can't deny them the leave, but you probably don't have to let them take it intermittently. If an employee, very importantly, if an employee has already exhausted their FMLA leave in the year, for example, if they were out on pregnancy leave from January to the end of March, this doesn't give them as far as we can tell, this doesn't give them new FMLA. They would not qualify anew for this 12 weeks. So they've already used it. Now, of course, it depends on how you count your 12 months, whether it's a look back or a look forward. And, that's all subject to your policies and procedures and things that we talk about. You can't suddenly change it to exclude somebody. However, you've traditionally managed your FMLA, keep doing it that way. And if they've already used it pursuant to that policy, then they're probably not going to be entitled to new FMLA because of this. And again, traditional FMLA, if somebody, for instance, goes out sick for COVID-19 or goes out sick for some other reason, they're still entitled to traditional FMLA, and that is not leave, that is not paid. So after you give them the 2 weeks of paid leave, if they are subject to COVID-19, and they're still sick, they still qualify for FMLA leave, but it is not paid because the paid FMLA is only to take care of a son or daughter under the age of 18. So just keep that in mind. It's not like 2 weeks after having COVID, you can let them go. If you're subject to the FMLA, you still have to give them that leave as well, just unpaid.
Hey, Cliff.
Mm-hmm.
Two questions. The first one, to answer your question, yes, nonprofits are included in this.
Certain nonprofits. Let's be clear. Certain nonprofits. I'm sorry. I'm thinking of CARES Act. You're absolutely right. Every employer is included, including nonprofits.
And we had another question about whether a confirmation of diagnosis would be required. And I guess I was kind of looking at the different requirements to take leave, one of which has symptoms and is seeking a diagnosis, the other advised by a healthcare provider. So do we know the kind of requirements as far as the employees, having a note from a doctor or some kind of official document once they've actually gotten a diagnosis?
So again, none of these things actually technically require a diagnosis. And I think that was in large part due to the fact that we are so limited on tests. And so if you look at those 6 reasons, and it's subject to a federal, state, or local quarantine or isolation order. Again, that doesn't necessarily require a diagnosis. If you've come in contact with it, then that may be enough to subject you to that order. If you actually have it, then so they should be able to show you that order or something to show that they were subject to it. Advised by a healthcare provider to self-quarantine. Again, that could be for an underlying condition related to COVID-19. If you have a chronic history of bronchitis, they may tell you have to be extra careful because that comorbidity is going to be something that makes you extra vulnerable, and I'm advising you to do that. And then you're right, experiencing symptoms and seeking a diagnosis. Now, once that diagnosis, if you're experiencing those symptoms and that diagnosis comes back negative, you're no longer seeking a diagnosis and no longer qualified for that leave. But there are requirements actually for the tax credit purposes and generally that the employer does have to require documentation to support the leave and what that qualifying reason is. That may be something as simple as a statement of the employee that they cannot work or telework. and the dates that are requested leave, and the supporting documentations may be the note from the doctor who advised the self-quarantine, the actual isolation or quarantine order. It may be the diagnosis. You want to be careful about having too much because you don't want to, run afoul of HIPAA or Americans with Disability or anything like that. It may be a posted notice of the closure of the school or an email from the school saying that we're closed. But you do want to collect and keep that documentation so that whenever you apply for your tax credit, which I'll talk about in just a second, that it's supported and they're not saying, oh, you're really just giving vacation leave here. You're buying down that vacation time so that you don't have to do it later. You're letting your people off, but it was really related to this. The tax credits, and I don't know if that's the next slide or not, that we are talking about is actually a credit against the employer share of the Social Security, the remedies for violation. We kind of talked a little bit about that. Again, for the FLSA, it's back wages, penalties, and attorney's fees. That's for the paid sick leave. For the EFMLA, it could be back wages, reinstatement. Importantly, there's no private right of action for employers under the EFMLA with fewer than 50 employees. So an employee, if you have fewer than 50 employees, can't bring their own enforcement action under EFMLA. They can under emergency sick leave potentially, but the Department of Labor can bring an action against whoever they want. So you can have one employee and they can sue you, and the Department of Labor can bring an enforcement action against you for a violation. So it's still not a good idea. Again, the tax credits. Yep.
Mr. Bernard asked whether public employees are included, and state and local public employers are included of all sizes, actually. Although the federal government has kind of a caveat that those 2 weeks of leave that are given are what's under the emergency paid sick leave provisions. The FMLA, what Cliff was referring to as the EFMLA, which is the 12 weeks for childcare, that expansion, the federal employees actually are not going to be afforded that 12 weeks under the EFMLA, but federal employees are included in the emergency paid sick leave. And again, the state and local public employees are included of all sizes, to both provisions.
Okay. Yeah, and that's correct. Thanks for that. So back to the tax credits. It's a credit against the employer share of the Social Security portion of payroll tax. If the payment that you've made exceeds the amount of that, it is a refundable credit. So you don't have to wait till next year to get this money back. You do have to front it, but when you file for your quarterly Social Security tax, you would just take that credit, and if it goes above that, they give it back to you. The notice requirements for this, the Department of Labor has published posters, and they have separate ones for federal employees and they have separate ones for general employees. So obviously, unless you're a federal employee, go for the general one. There's some confusion about that. The Department of Labor, they've posted those on their website, and I'm happy to, whenever we go through these questions, which I see there are a lot of them, we can attach those as well. They have to be posted in a conspicuous place wherever you have employees. So wherever you generally put your employment posters, you want to put this up there as well. If you have more than one location where you have employees, you want to put it in all of those places. And then if you have a lot of teleworking people, or if you have teleworking people at all, you should email them a copy, because there would be no conspicuous place to post it absent them going post it on their door. So you want to email them a copy so they have a notification of it as well. That's sort of, I think that kind of covers the broad strokes that we wanted to talk about. But again, we are happy to discuss or answer the questions now going forward. I tried to leave about 20 minutes to do that. So Lance has been going through and will continue to go through the questions and kind of feed them to me or answer them himself as we go.
One of the questions from Mr. Gregg concerns the CARES Act. He asked if an employer retains all the employees but has to adjust the hours down because of lack of sales, does that jeopardize the forgivable amount given to employees? And it does. There's a calculation that's provided within the statute that will take into account whether anyone has been laid off or any numbers have been reduced, and that will affect the forgivable amount given to employees under the CARES Act.
And speaking of layoffs, I want to be clear about the Leave Act provisions as well. If you shut down your business because of the stay-at-home order or whatever, if the person is on leave because of that, even if they subsequently have a triggering event, they don't have the right to then start the leave if they would have been home anyway. Similarly, if they're in the middle of their leave and you shut down your business as a result of the stay-at-home order or whatever, you have to pay them through that date. But the guidance that we've seen says that if they at that point would no longer be working in any event, you don't have to continue that leave. Again, this is not legally binding. These are FAQs that the Department of Labor is putting out. We haven't seen those regulations, but that is what the Department of Labor is saying, that if they would, once they would no longer be employed anyway, or once you would lay them off anyway, well, you certainly can't retaliate and lay off because of it. You can't retaliate. If they would have been laid off anyway, if you eliminated all of their position, then it's okay to do that even if they're on leave at that point.
Cliff, Miss Tammy asked if hourly employees were reduced to 35 hours per week as of March 23rd, 2020, how would that affect the calculation of how many hours they're allowed to take? They're still given all 80 hours. I know they'll still be counted as an employee because they'll be part-time, which are also included within the calculation, part-time and full-time, to get to that 500 employee threshold. But as to the number of hours they were working in the weeks prior to the April 1st effective date, does that affect how much leave they're going to be granted under the statute?
So yeah, it will. The way it's defined in the FAQs is that for non-40-hour plus employees, what you do is you look back 2 weeks to their average number of hours or the hours that they would have worked. Again, there's not a lot of clarity. Does that mean that if you reduce them on March 23rd, 1 week before this came into effect, and they would have worked 35 hours each week thereafter, would you only pay the 35 or would you take that 2 week average? To be on the safe side, I'd give them the 2 week average if you can. Again, especially since it's a refundable tax credit. But again, we wait on the regulations, and I'm hopeful that the regulations say, well, if you'd done this before, and again, they would not have been working those hours anyway, 35 hours is likely the hours that you would pay for.
And Ms. Stella Maris asked, how do you apply for the tax credit? So I guess, you spoke a little bit about what the tax credit is going to be applied against. Are there any steps that they need to take to affect that tax credit, and yeah?
Not that I'm aware of. I haven't seen if there's going to be some new, and I suspect there will be. I suspect whenever you file your paperwork for your quarterly taxes, they're going to amend that tax form to include a line item for this. I haven't seen that amended tax form yet, but I don't think it's something that's, because it becomes a credit against what you owe, and it's not necessarily a check from the government. I don't think there's going to be a quote unquote application. I think it's going to be a deduction from your quarterly taxes, the Social Security portion that you pay quarterly. And again, on that line or in that return, you may end up with a negative number and submit that. But I haven't seen that form, but that's, I suspect, how they will do it.
And Mr. James Poche asked if efficiency of the telework is impacted and reduces billable time to clients, how does the loss get considered? And so I guess that also would bring up a question of salary employees versus hourly employees. And I'm not sure how the income would really affect it. It's more just what's being paid to the employee themselves, correct?
Right. So the answer to that is the productivity is not taken into consideration. If the employee is in your service, and that means whether they're sitting around waiting for something to do, if that means that they are, whatever it may be, if they are quote unquote working, they are signed in, if they are on the clock, you got to pay them no matter how productive they are. That doesn't mean that you can't say, guys, you guys are, you're billing me for 40 hours. I need to cut this back because we're not getting the work done. I'm only going to be able to let you work 30 hours as a result. You can still do that. And you can also say, hey, look, if you guys are going to work, I need you to be just as productive as you were. You've got to figure out a way to do it. Go lock yourself in a bedroom away from your kids if that's what you have to do. then you can do that. So I mean that is something that can be addressed otherwise. But if they're in your service, then you have to be paying them their hourly rate. Now, there's nothing here that says that you can't also say, as a result of this, I'm going to reduce hourly rates. There's nothing there that says that. You got to remember your typical regular rate or whatever for calculation purposes. But if you want to go forward and say, hey, I was paying you $30 an hour, but as a result of this, I can only pay you $25 an hour, that is something that you can do as well.
They have various questions about the CARES Act, which we are knowledgeable on. But I wanted to ask Andre, is One Acadiana given a presentation elsewhere on the CARES Act specifically?
Yes, so we had a presentation by the PCAR group on the CARES Act this past Friday. Those resources we shared after the webinar, and they're available on One Acadiana's COVID-19 resource page. So if you go to oneacadiana.org, you click on our COVID-19 resource page, you can access the materials from that webinar.
And we are happy to try and answer as many of those questions as we can. I will tell you that the CARES Act, while it certainly has legal implications, is probably more accounting based. And we're not tax accountants, but we can answer what we can. I mean, Lance has done a lot of work on that, and I'm happy to let him field a few of those questions if he can, and talk about that a little bit, if that's something that everybody's interested in.
Yeah, one of the questions asks, what certifies that a business has been impacted for the CARES Act? And for the SBA forgivable loan, it's actually not too high of requirements. The business just has to certify that the loan's necessary to support ongoing operations. The funds will be used to retain workers and maintain payroll and make mortgage payments, lease payments, utility payments. And the applicant doesn't have an application pending and hasn't received amounts under the CARES Act or another SBA provision. So really, it's just the business certifying that the loan is needed and the loan will be used for these certain reasons. Above that, there's not too much. They're making it very easy so that people can apply for and get these loans in short order, it seems.
And one thing to keep in mind is that, let's say you get the loan and for the purpose of it being forgivable, and Lance, correct me if I'm wrong, my understanding is that I forget how long, is the interest deferred for 6 months?
12
months.
So payment deferred for 12.
Okay, and I think interest may also be deferred for a certain period of time. So let's say you get the loan and you qualify for it, and thereafter the government says, well, you know what, you don't qualify for the forgiveness. Number one, they're low interest loans, so you're not going to be out that much money even if you have to pay interest. But number two, just because you qualify for the loan doesn't mean you have to take the loan. So you can always say, never mind, I don't need the money if I'm not going to qualify for the forgiveness.
Right, and it's actually it's complete deferment for the loan. So principal, interest, and fees are all deferred for 6 to 12 months. I believe it's 6 months and you have to reapply and you get an extra 6 months. But I don't think it's a very difficult application.
Right.
So Ms. Kramer asked, would the 80-hour emergency paid sick leave be considered part of the 12 weeks under EFMLA? And what part of the leave provided under EFMLA, in addition to the paid sick leave, is also paid leave?
So that's
is that 100% or 2/3?
Right. So that's and it depends. If you're taking the emergency sick leave for if you haven't already exhausted your emergency sick leave, and you are taking that emergency sick leave to care for the son or daughter who is out of school and doesn't have a healthcare provider, or not healthcare, a child care provider, and the employee elects to take that paid sick leave for that first 2 weeks of unpaid EFMLA leave, then yeah, it's coextensive. They don't get 14 weeks at that point. They would get 2 weeks paid under emergency sick leave at 2/3, because that's what it's paid at for that reason. And at the same time, it would exhaust that first 2 weeks of unpaid Emergency Family Medical Leave Act, and then it would pick up for the remaining 10 weeks of being paid at 2/3 under Emergency Family Medical Leave Act for that remaining 10 weeks there. I think that answers.
I might have missed it while I was reading. questions, but did you discuss that 10 days the first 10 days of one of the leave provisions, the employer is not required to pay.
Yeah,
But
that's
that
and
can
that's
be
emergency.
supplemented.
That's Emergency Family Medical Leave Act. The first 10 days are unpaid unless they opt and they have the ability to use their paid sick leave to cover that part of it. I hope if that didn't answer you, please let us know if that didn't answer the question, because I want to make sure that we do get that.
I'm kind of trying to read through to see if there's any other questions we can touch on that don't require kind of a deeper dive.
Right. We have about 10 minutes left. And so, I mean, we're going to try to cover as much as we can in that time. I'll kind of, now that I'm not talking incessantly, I can kind of look through as well.
I'll chime in too, and I think you've already addressed this, Clip, but if you don't mind addressing it again, there was a question about if a business is essential and the employee is choosing to not go to work simply because of the stay-at-home order, is the employer required to pay that employee?
No, and the employer is only required to pay for the 6 reasons. So unless they're subject to that isolation order, or they have a son or daughter at home, or any of those things, there's no triggering event. And again, even if there's a triggering event, if they can telework but just choose not to, it also doesn't trigger that. So it's a choice to just stay home and say, I'm not doing this. Now, keep in mind, can they go to a doctor and say, hey, I have this underlying condition, I really would prefer to self-quarantine, can you give me a note? Once they get to that note and they've been advised by a healthcare professional, it changes the calculus. But if they're just saying, I just want to hunker down because I'm scared of this virus, there's nothing here that says that you have to pay them for that. Again,
Okay,
nothing
so
in this.
Ms.
Yeah, okay.
Ms. Davis asked if there's a form or a process if a company wants to file for the FMLA exemption, and I believe she probably means the under 50 employees.
Yeah.
Yeah.
So there's not a form out there right now. Again, we continue to wait on regulations, which even though this goes into effect tomorrow, they're still taking, I think last time I checked, they're still taking comments on it until April 10th. So they expect the regulations sometime in April. There's not a particular form. It just says that the guidance that we have right now says that an authorized officer has to certify, and whether that's by affidavit, whether that's by a general proclamation, we're not sure, but an authorized officer has to certify one of those 3 things that we talked about, and I can pull those up real quick again. Either that the provision of the sick leave of the leave would be more than what the business's revenues are and cause the business to cease operation, or the absence of the employee who's requesting the leave would put the business at a substantial risk because of their specialized skill, knowledge of the business or responsibilities, or that there are not sufficient workers who are able basically to keep the business running, who have that special skill or whatever it may be, to operate at a minimal capacity. Again, that's only if you have 50 or fewer employees and you can get one of your officers to make that certification.
And Ms. Kathy asks, what requirements are there to qualify for forgiveness under the CARES Act for the payroll protection program? The loan indebtedness under the CARES Act will be forgiven for an 8-week period in an amount equal to the costs incurred and payments made for a very select group of expenses: payroll, rent, utilities, and interest payments on mortgages. The principal amount that's going to be forgiven the amount that's going to be forgiven can't exceed the principal amount of the loan, and the forgiveness is going to be reduced for any employee or wage reductions, but the employer can rehire the employees who were terminated to kind of cure that defect that might reduce their forgiveness.
We probably have time for one more
Sorry,
question too. We probably have time for one more question too before we need to wrap up.
So Mr. Mike DeHart asks whether churches are included in this the family medical leave expansion and the paid sick leave. And as we mentioned earlier, Cliff, I believe all nonprofits are, right?
Yeah, as there's been
includes all
no
tax exempt?
carve out. It's, yeah, I mean, they're following the traditional definition of employer under the Fair Labor Standards Act. So which again is a very broad, completely unhelpful definition of an employer is someone who employs an employee. So that there's no carve out there that we've seen. Theoretically, again, we could get some regulation that says we define an employer not to include that, but we haven't seen that. So as of now, we're operating that every individual, corporation, entity, whatever it may be that employs an employee, but less than 500 employees is a covered employer for the purposes of these acts.
And I'm going to ask one more question that was just sent to me privately. If a service that is provided by the company is not being provided due to the governor's order, do those employees get paid if their work cannot be done at home or on a computer?
Well, they're not required to. If you need to, if you provide a particular service and there's no work for that employee, there's nothing in these acts that trigger a requirement to be paid. You're free to do that, clearly. I mean, if you have that ability, you're free to do that. And there's some things in the CARES Act that incentivize you to do that. But no, the answer is at that point, you could furlough them, you can lay them off, you can do whatever you need to do if they're exempt employees, keep in mind that if they do any work in a week, you owe them for that week's salary. But if they're hourly employees, you don't have to pay them for any hour that they don't work. If they are exempt employees and they don't do any work in a week and you say, look, they're furloughed, then of course you don't have to pay them as well. But yeah, no, there's nothing in there that says you have to pay them if you're not if you don't have the work, you don't have to pay them. You can furlough them or lay them off.
Got it. And Britt just asked for the slide that lists the reasons an employer would be required to pay their employees. We will send the full slide deck back around to everyone, and we'll try to.
I don't know that those 6 reasons were included, but I can copy and paste those to Andre, and when he sends out the slide deck, those 6 reasons will be listed.
That would be awesome. Well, that does bring us to the end of today's webinar. Thank you again to Cliff LaCour and Lance Pearson of Nooner Pate for leading today's presentation. And thanks to all of our participants for joining us. We will be sharing the video and other materials from today's webinar within the next 24 hours. You can access all of these materials as soon as they're available at oneacadiana.org/COVID-19-resources. And all of the partner organizations who made today's webinar possible will be sharing the video and materials as well. We hope today's webinar was helpful, and we look forward to offering additional Acadiana Business Resource webinars going forward. Stay tuned for follow-up emails from us and our partners. This concludes today's webinar. Thank you all again, and please stay safe.